Skin and stress. Seborrheic dermatitis by the structure and function 1 group Pomerac. The members are Ayana, Devine, Genevieve, Mandisa, Matana, and Laverne. Dermatitis is an inflammatory and chronic disease with high incidence and prevalence, with 1 to 3% in the general population, 3 to 5% in young adults, and 40 to 80% in HIV-positive individuals. In 1887, seborrheic dermatitis was first described by Paul Gerson Unna. In 1894, a hypothesis was made by Unna and Seborrheic that the yeast Malassezia bacteria were responsible for seborrheic dermatitis. In 1984, Shutter discovered that seborrheic dermatitis can be treated with oral ketoconazole. Although the condition was first described in 1887, its clinical aspects and clinical forms have still not been well individualized. The disease, despite having clinical features like dermatitis, does not have the same histopathologic features or the same progressive clinical behavior. Seborrheic dermatitis is a common papillosquamous skin disease that is most prevalent in infancy and middle age, and it usually presents differently in these two age groups. Seborrheic dermatitis appears in areas rich in sebaceous glands, particularly the scalp, face, and body folds. Infants are not usually troubled by seborrheic dermatitis, but it may cause significant parental anxiety, often appearing as firm, greasy scales on the crown and frontal regions of the scalp. It occurs in the first 3 months of life and is commonly known as cradle cap. It is mild, self-limiting, and resolving unexpectedly in most cases by the first year of life. Adult seborrheic dermatitis, on the other hand, is categorized by a relapsing and remitting pattern of disease and is ranked third behind atopic and contact dermatitis for its potential to impair the quality of life.
What causes seborrheic dermatitis? Seborrheic dermatitis is a common skin condition that causes redness, itching, and flaking on parts of the body with a high density of sebaceous gland. This is a common skin condition that causes scaly rash on oily areas of the body. Seborrheic dermatitis is usually caused by a combination of genetic and environmental factors. The triggers are usually an inflammatory reaction to excess Malassezia yeast, also sometimes called Pittosporum. This organism, which normally lives on the skin surface, is likely cause of seborrheic dermatitis. The Malassezia overgrows and the immune system seems to overreact to it, leading to a fungal infection that results in skin changes. Certain medical conditions can cause the development of seborrheic dermatitis, including psoriasis, HIV, acne, Parkinson's disease, epilepsy, alcoholism, depression, eating disorder, and recovery from a stroke or heart attack. Common triggers for seborrheic dermatitis include stress, hormonal changes or illness, rash, detergents, solvents, chemicals, and soap, harsh weather or a change in the season, and some medications. Like all forms of eczema, seborrheic dermatitis is not contagious. You cannot catch it from another person. Dandruff may be considered the mildest form of seborrheic dermatitis. The two conditions are similar since they both cause a white to yellowish scale, which may be dry, greasy, and itchy. Sometimes dandruff and seborrheic dermatitis are treated in similar ways. However, a dermatologist may recommend additional treatment for a patient with seborrheic dermatitis. Unlike dandruff, seborrheic dermatitis develops on more than the scalp. It can appear on the ears, eyebrows, beard, chest, or skin around the nostril. Another difference between the two conditions is that seborrheic dermatitis causes inflammation, but dandruff does not.
Symptoms associated with seborrheic dermatitis: dry, flaky skin,
This can develop on any part of your body that has seborrheic dermatitis, including the face or chest. Patches of greasy skin covered with flaky white or yellow scales or crust on the scalp. Face, sides of the nose, eyebrows, ears, eyelids, chest, armpits, groin area, or under the breasts. Rash on the scalp. This can be dry, have greasy scales, or both. If you have a darker skin tone, the rash tends to look pink, slightly purple, or lighter than your natural skin tone. In lighter skin tones, the rash is usually red or raised. Seborrheic dermatitis causes scaly patches, inflamed skin, and stubborn dandruff.
Ring-shaped rash. For those with patellary seborrheic dermatitis, African Americans and those with skin of color might experience patellary seborrheic dermatitis, a more severe form where lesions form around the hairline and skin discoloration happens. Usually, the discolored skin manifests in a ring-shaped rash. Itchiness. The affected skin sometimes crusts over and cuts containing sebum can form. Erythema or redness of the skin caused by inflammation may also be experienced. If the flare-ups occur increasingly in the hairline, those who itch the affected areas too much may experience hair loss as well.
The following are images that illustrate the appearance of seborrheic dermatitis on the face and scalp of persons with fair and dark skin tones. The last image illustrates a comparison between the both skin tones.
Pharmacological intervention for seborrheic dermatitis. For adolescents and adults, the main treatment for seborrheic dermatitis are medicated shampoos, creams, and lotions. If non-prescription products and self-care habits don't help, your healthcare provider might suggest that you try one or more of these treatments. Antifungal gels, shampoos, foams, or alternated with another medication. Your healthcare provider might suggest you try a product with 2% ketoconazole or 1% cyclopirox. Or you might rotate between two or more products. Ketoconazole can worsen the dryness of tightly coiled or chemically treated hair and increase the risk of breakage. To ease this effect, use it only once a week with a moisturizing conditioner. Medicated shampoos can be used once a day or 2 to 3 times a week for several weeks. Let the product sit on your scalp for a few minutes. See the package directions so it has time to work. Then rinse. After your symptoms clear up, use the medicated shampoo just once a week or once every 2 weeks. This will help prevent a relapse. Creams, lotions, or ointments that control inflammation. Your healthcare provider might prescribe a prescription strength corticosteroid you apply to the scalp or affected area. These include hydrocortisone, fluocinolone, clobetasol, and deonide. They are effective and easy to use, and use them only until symptoms clear up. If used for many weeks or months without a break, they can cause side effects. These include loss of skin color, thinning skin, and skin showing streaks or lines. Creams or ointments with a calcineurin inhibitor, such as tacrolimus or pimecrolimus, may be effective. Another benefit is that they have fewer side effects than corticosteroids do, but they are not first choice treatments because the Food and Drug Administration has concerns about a possible association with cancer. In addition, tacrolimus and pimecrolimus cause more than mild cost more than mild corticosteroid medications. The antifungal medication you take as a pill. If your condition isn't improving with other treatments or is severe, your healthcare provider might prescribe antifungal medication in pill form.
I'm Divine Erica, and I'll be reading out alternative medicinal treatments for seborrheic dermatitis. Alternative medicinal treatments for seborrheic dermatitis include tea tree oil, aloe vera, olive oil, and apple cider vinegar. These remedies may have anti-inflammatory and antifungal properties. However, their efficacy has not been established in clinical studies. Therefore, using these natural remedies as a sole treatment for seborrheic dermatitis is not advised. Tea tree oil. Tea tree oil is obtained from the leaves of the tea tree, also called Melaleuca alternifolia, and it's indigenous to Australia. It has been used for medicinal purposes for centuries to clean wounds and treat infections. Tea tree oil effectively fights several bacteria, viruses, and fungi. It is used as an ingredient in shampoos and soaps. They may relieve the symptoms of seborrheic dermatitis. To apply pure tea tree oil on the scalp, it must be diluted with another oil, such as coconut oil, and patch tested to prevent allergic reactions. Aloe vera. The aloe vera plant is effective in the treatment of seborrheic dermatitis. It is primarily known for treating minor wounds and burns. The gel inside its long, spiky leaves feels cool when used on the skin. This aids in soothing inflammation and burn-related pain. Aloe vera gel has components that promote healing, such as vitamins, minerals, and amino acids. This plant can help seborrheic dermatitis due to its moisturizing effect on dry skin, anti-inflammatory actions that help reduce irritation, enzymes that may help reduce inflammation, and antioxidant properties that may prevent cell damage. To use it, you can purchase aloe vera gel at your local pharmacy or buy it online. It can be applied before or after shampooing by gently applying the gel to your head, letting it sit for 30 minutes, and rinsing it with a mild shampoo to get it off the scalp. Aloe vera gel is safe, however, some may experience an allergic reaction to the plant. Apple cider vinegar. Apple cider vinegar is a popular remedy used to treat seborrheic dermatitis. It has antimicrobial and anti-inflammatory properties that may be useful in relieving symptoms of seborrheic dermatitis. Apple cider vinegar contains 5 to 6% of acetic acid. This weak acid acts as a barrier in protecting the skin and restores its optimal pH level. Anecdotal evidence reports positive results. However, scientific evidence has not proven its efficacy in combating seborrheic dermatitis. Before applying apple cider vinegar to the body, dilute it with water to prevent chemical burns. Then conduct a skin patch test to avoid allergic reactions. There are 3 methods for applying apple cider vinegar. They are using a spray bottle to apply the mixture on the scalp, using a cotton bud to apply the mixture on the affected area, and directly applying the mixture to your scalp.
The following slides show the sources of information used to compile and organize our report on seborrheic dermatitis. Thank you for viewing the presentation by the SNF1 Group Pomerac on the topic of seborrheic dermatitis.